Have you ever looked down at your waistline after 60 and thought, no matter what I do, this area just keeps getting bigger? For many people, that moment comes quietly. A favorite pair of pants feels tighter. A belt needs a new notch. Shirts fit differently around the middle than they used to. And the easiest explanation is often the one we tell ourselves first: I'm getting older. This is just part of aging. But that may not be the whole story. A larger waistline after 60 is common, but it is not always just about age. Sometimes it can be one of the body's subtle ways of signaling that other changes are happening beneath the surface. Changes involving blood sugar, muscle mass, sleep, hormones, activity levels, medications, or overall metabolic health. That does not mean something is seriously wrong, and it certainly does not mean you should panic every time the scale goes up a few pounds. What it does mean is that belly fat deserves a closer look than many people give it. Because after 60, the conversation is no longer just about appearance. It is about understanding what your body may be trying to tell you. One of the biggest reasons this topic causes confusion is that many people assume fat is simply fat, but the body is a little more complicated than that. There is a fat that sits just beneath the skin. This is the kind you can pinch with your fingers. Then there is fat stored deeper inside the abdomen, surrounding organs such as the liver, intestines, and other structures. Researchers often refer to this deeper fat as visceral fat. Why does that matter? Because visceral fat appears to behave differently from fat stored elsewhere in the body. It is more closely associated with conditions involving blood sugar, blood pressure, cholesterol, inflammation, and cardiovascular health. That does not mean a larger belly automatically means you have a disease. It doesn't. But it may be one clue that your body is managing energy, blood sugar, or metabolism differently than it did years ago, and that distinction becomes especially important as we age. Many older adults focus entirely on body weight. They step on the scale and assume the number tells the whole story. Sometimes it doesn't. A person can maintain roughly the same weight for years and still notice a growing waistline. How is that possible? One reason is that aging often changes body composition. Over time, many adults gradually lose muscle. This process can occur so slowly that it is easy to miss. You may not notice it month to month, but over several years, the difference can become significant. As muscle decreases, fat may make up a larger percentage of body weight. The scale may not change dramatically, but the body can look and function differently. This is one reason health experts often emphasize that weight alone does not always tell the complete story in older adults. In fact, some people are surprised to learn that they can have a body weight considered normal while still carrying more abdominal fat than they realize. That is why paying attention to waist size can sometimes provide information that the scale misses. Another misunderstanding is the belief that belly fat is simply the result of poor self-control. Many older adults quietly blame themselves. They think they must have become lazy, or that they simply lack discipline. But the reality is often far more complicated. The body changes with age. Hormones change. Sleep patterns change. Muscle mass changes. Activity levels change. Medications change. Even the way the body responds to food can change. All of these factors can influence where weight is stored. One possible factor is insulin resistance. Without getting too technical, insulin helps move sugar from the bloodstream into cells where it can be used for energy. As some people get older, the body may become less responsive to insulin. When that happens, blood sugar regulation can become more difficult. Over time, this can sometimes be associated with increased fat storage around the abdomen. Again, this does not mean belly fat proves someone has diabetes. It doesn't. But it may be one reason to pay attention if a growing waistline appears alongside rising blood sugar levels, increasing fatigue, stronger sugar cravings, or more frequent nighttime trips to the bathroom. Those patterns are worth discussing with a healthcare professional. Another piece of the puzzle is muscle. Most people think of muscle as something that helps us lift groceries or climb stairs, but muscle does much more than that. Muscle plays an important role in movement, balance, strength, metabolism, and blood sugar regulation. When muscle mass declines, the body may not use energy as efficiently as it once did. Daily activity can become harder. Fatigue can increase. Physical activity may gradually decrease without a person fully realizing it. Over time, those changes can contribute to fat accumulation around the midsection. This is one reason experts often emphasize protecting muscle as we age. After 60, maintaining strength is not only about staying active, it is also about supporting long-term metabolic health. For women, hormonal changes may add another layer. Many women notice that fat distribution shifts after menopause. Weight that once appeared in the hips or thighs may become more concentrated around the abdomen. This can feel frustrating because eating habits may not have changed very much, but menopause is only one possible factor. Sleep quality, physical activity, medications, stress levels, and metabolic health can all play a role as well. For men, changes in activity levels, muscle mass, sleep quality, and overall metabolic health can also contribute to increased abdominal fat. In other words, this is not simply a men's issue or a women's issue. It is an aging issue that can affect almost everyone. Sleep is another factor that often gets overlooked. Many older adults accept poor sleep as normal. They wake several times during the night. They struggle to fall asleep. They feel tired throughout the day. Eventually, it becomes part of everyday life. But sleep and metabolism are closely connected. Poor sleep can sometimes affect hunger signals, food choices, energy levels, and blood sugar regulation. And when sleep quality declines, people often become less active simply because they feel exhausted. In some cases, symptoms such as loud snoring, daytime fatigue, morning headaches, or waking up gasping for air may be worth discussing with a doctor because sleep-related breathing disorders become more common with age. Not everyone with belly fat has a sleep problem, but sleep may be part of the picture more often than many people realize. Medications can sometimes be part of the story as well. Certain medications may influence appetite, fluid retention, blood sugar, energy levels, or body weight. That does not mean the medication is harmful or unnecessary. Many medications provide important benefits and should never be stopped without medical guidance. However, if you notice significant changes in your waistline after starting a new medication or changing a dosage, it may be worth asking your doctor or pharmacist whether weight-related side effects could be contributing. Sometimes the answer is yes, sometimes it isn't. The important thing is to ask rather than guess. So what signs deserve attention? The first thing to notice is the pattern. Has your waist gradually increased over many years? Or has the change happened relatively quickly? A slow increase may reflect the cumulative effects of aging, reduced activity, muscle loss, sleep changes, or metabolic shifts. A rapid change deserves closer attention, particularly if it appears alongside fatigue, swelling, shortness of breath, abdominal discomfort, or other new symptoms. Another clue is how your clothes fit. Many people notice changes there before they notice changes on the scale. If your weight appears stable but your waist continues to expand, that may suggest changes in body composition rather than simple weight gain. It is also helpful to look at the bigger picture. A larger waistline combined with rising blood pressure may suggest it is time to review cardiovascular risk factors. A growing belly combined with elevated blood sugar may be worth discussing with your healthcare provider. If increasing abdominal fat appears alongside muscle weakness, declining strength, worsening fatigue, or reduced mobility, it may be useful to explore whether muscle loss, sleep issues, nutrition, medication effects, or other factors could be involved. The goal is not to diagnose yourself. The goal is to notice patterns, and when something changes, ask questions. Fortunately, there are practical habits that can support overall health without relying on extreme diets, miracle supplements, or unrealistic promises. One simple habit is paying attention to waist size from time to time instead of focusing only on body weight. Many people become discouraged when the scale does not move, but the scale is only one measurement. Your waistline may reveal trends that body weight alone cannot. Another important habit is protecting muscle. Walking remains one of the most valuable forms of activity for many older adults. But maintaining muscle often requires some type of strength-building activity as well. The exact approach will vary from person to person. For some, that may mean resistance bands. For others, light weights, chair exercises, supervised programs, or bodyweight movements may be appropriate. The safest choice depends on individual health conditions, mobility, balance, and medical history. Nutrition also matters. The goal is not starvation. The goal is nourishment. Many older adults benefit from focusing on balanced meals that include adequate protein, fiber-rich foods, fruits, vegetables, healthy fats, and sufficient hydration. Protein deserves special attention because maintaining muscle becomes increasingly important with age. Of course, anyone with kidney disease or other medical conditions should discuss dietary changes with their healthcare provider. It is also worth taking an honest look at highly processed foods, added sugars, and alcohol consumption. No single food causes belly fat. No single food eliminates it. But long-term eating patterns can influence blood sugar, appetite, and weight distribution over time. Small, sustainable improvements are usually more realistic than dramatic diets that are impossible to maintain. Sleep deserves attention as well. If you regularly wake up exhausted, struggle with daytime fatigue, or feel that your sleep quality has declined, that conversation may be just as important as discussing diet or exercise. And finally, do not overlook the value of reviewing medications and supplements. Many people are surprised to discover how complicated these interactions can become over time. Bringing a complete list of prescriptions, over-the-counter medications, and supplements to a healthcare appointment can sometimes uncover factors that would otherwise be missed. So when should you speak with a doctor? If your abdominal size changes suddenly, if weight gain is unexplained, if you develop swelling, shortness of breath, chest discomfort, severe fatigue, new weakness, abdominal pain, or significant changes in appetite, it is important to seek medical advice. The same is true if you notice rising blood pressure, increasing blood sugar levels, worsening sleep problems, or other persistent symptoms that concern you. Most importantly, remember this: a growing waistline after 60 is not simply a cosmetic issue, but it is not a reason for fear either. Think of it as information. Your body is constantly sending signals. Some are obvious, others are subtle. A changing waistline may be one of those subtle signals. It may be linked to blood sugar. It may be linked to muscle loss. It may be related to sleep, activity, medications, hormones, or other aspects of health. The important thing is not to ignore it and not to jump to conclusions. Pay attention, stay curious, ask questions, and work with qualified healthcare professionals when changes appear, because healthy aging is not about chasing perfection. It is about understanding your body well enough to respond when it starts telling you something important. If you found this explanation helpful, consider subscribing for more clear, practical discussions about health after 60, aging body signals, and the everyday changes that may be worth paying attention to as the years go by.